Agenda Item 16.2, Intergovernmental Negotiating Body to draft and negotiate a WHO Convention, agreement, or other international instrument on pandemic prevention, preparedness, and response as approved by Committee A, which is contained in document A78/42. Dear delegates, to optimize our time, I kindly ask that any congratulatory messages pertaining to the anticipated adoption of the draft WHO Pandemic Agreement be taken up in the plenary under Agenda Item number 3. The report contains one resolution to adopt the WHO Pandemic Agreement entitled Draft Resolution on the WHO Pandemic Agreement. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The pandemic agreement is attached and is hereby adopted. The first report of the Committee A is also approved. Now, I would like to invite youth delegates to provide short interventions. First, I hand the floor to the delegate from Thailand. Since the youth delegate from Thailand is not ready, may I ask the youth speaker from Panama to take the floor? We will have the youth speaker from Thailand on the rostrum.
Dear chairs, distinguished delegates, and fellow youth, on behalf of the youth of Thailand and the CRO, I express our deepest appreciation to the INB and all member states for your commitment in shaping the pandemic agreement against the odds and in record time. But we must be honest, interest in pandemic preparedness is fading, yet the pandemic agreement is not a document of the past. It is a tool for the future, our future. Many of us, the youth, were not just students during the last pandemic. We were caregivers, community health workers, and volunteers, and in some cases, we were mourners. For us, equity is not a political ideal, it is a lifeline. Let this agreement not be remembered for what each country might sacrifice, but for how well it protects the most vulnerable in the next pandemic, including us, the young people who will inherit this world. We urge member states to remain engaged and to bring youth into future negotiations not as tokens, but as partners. The next emergency may be inevitable, but a more just, prepared, and inclusive response is still within our reach. Thank you.
Thank you. Now let us turn to the youth speaker from Panama.
Hoy,
Today, as a young person from Panama, a country in the Americas region, we celebrate and welcome the historic adoption of the pandemic agreement. We recognize the efforts of more than 190 countries, including states from our region who have worked tirelessly for more than 3 years to achieve this global consensus. A day such as today, 5 years ago, I was at home with my family following preventive measures 1 month after the first announcement of a positive case in Panama and after the quarantine that had been set in my country. We were listening to many news coming through social networks, and this is a threat and something that we see that outlined the situation of something that changed our lives. I was in my first year of medical studies, looking forward to my future, and I never imagined what I would say today. I survived a pandemic. Sadly, there are many people who are not here today to say this. We have seen families and homes destroyed and people living with the sequels of the pandemic. This resolution is part of the commitment of the Americas towards international cooperation and solidarity. And from the point of view of the regional youth, we welcome the fact that it recognizes the inequalities that affected the region during a pandemic and that it will ensure we have equal access to vaccines and products and that no one will be left behind, in particular in countries with lower resources. And we believe in the One World for Health, which looks at the One Health perspective, looking at animal, environmental and human health together. And we believe in the building of health systems and strengthening of effective communications to fight against misinformation, which particularly affects the young generation. As someone who lived the effects of the pandemic in education, our mental health, we recognize our will to participate actively, and we call on the Americas and the world to guarantee spaces for young people to participate, to ensure we ensure equity, innovation and transparency in public health policies. We in Panama are prepared to advocate for a fairer health system for all, and we are ready to be involved in decision-making spaces that involve our future. Thanks to the agreement of the nations and diplomacy, after years of discussion, we have a clear framework which helps us to react in a more agile and substantive way to a new pandemic. This is a way to ensure that the world, our region as well, are a safer and more fair world with solidarity. Thank you.
Thank you. Now let us turn to the youth speaker from Norway.
President, Director General, Excellencies. On behalf of Norway, I would like to congratulate all member states on the adoption of this historic pandemic agreement. As Director General, Dr. Tedros has rightly said, this is an agreement for future generations. For young people, the COVID-19 pandemic brought disruption to education, the collapse of entry-level jobs, and unheard of isolation during our formative years. We remember closed borders, closed schools, and closed rooms. And we are still understanding the long-term effects on our generation. What we have asked for since are open channel, open data, and open cooperation. The foundation we have laid with adoption today is only the beginning of operational multilateralism. It marks the start of building the infrastructure that will allow the world to prepare prevent, and respond collectively to future global crises. Given the growing risk of emerging zoonosis, the inclusion of One Health approach is a critical step forward. Human, animal, and environmental health are interlinked. And to prevent the next pandemic, we need to act upstream, across sectors, borders, and generations. As a medical student, I also welcome the agreement's attention to the protection of healthcare workers, the backbone of health systems and crucial actors during pandemics. Equity is a necessary condition for a global health security. Pandemics are prolonged when access depends on wealth and not needs. We welcome progress made on commitments to information sharing, technology transfer, and global supply chain coordination. These are the systems that determine whether a response is equitable. Today, you, the member states, have chosen solidarity over fragmentation. The path to consensus has not been easy, and yes, challenges remain. The finalization of the pathogen access and benefit sharing system will be crucial. But it is important to recognize what has been achieved. It is not only the most difficult issues that define the value of this agreement. Its strength lies in our shared vision, in the affirmation that global preparedness is a shared responsibility, that the health of one impacts health of all, that we are only as strong as the most vulnerable among us. Norway welcomes this resolution proud and excited and look forward to the day we can celebrate the completion of the treaty. Thank you so much.
Thank you. Now, let us turn to the youth speaker from Morocco.
Mr. President, distinguished delegates, bonjour, assalamu alaikum, good morning. My name is Selma. I'm a medical student from Morocco, and I have the honor to deliver this statement on behalf of the youth of the Eastern Mediterranean region. We extend our sincere appreciation to the Intergovernmental Negotiating Body and its Bureau for their dedication, resilience, and vision. As youth, we recognize how crucial this moment is for today's global health governance and for the world we will inherit. It is a powerful testament to the will of the member states to work together in the aftermath of a devastating pandemic and to translate hard-earned lessons into concrete commitments, commitments that will shape the future of generations to come. We welcome the final draft as a foundation for a more coherent, youth-inclusive, and equitable global approach to pandemic prevention, preparedness, and response. This text reflects compromise, yes, but also vision. It affirms the primacy of solidarity and the urgency of stronger national health systems. For young people of our region, it represents hope, a signal that our future matters and that for our resilience is not taken for granted. Throughout the COVID-19 pandemic, young people in the Eastern Mediterranean region took initiative, creating digital campaigns to counter misinformation, supporting mental health peer networks, and stepping into frontline roles in clinics and hospitals. We believe this agreement must institutionalize such engagement. Youth must be involved not only in risk communication, but in the co-design and delivery of health promotion, community response strategies, and pandemic education. Investing in youth-led solutions, including platforms that address access to information, mental health, and continuity of education, will help ensure no one is left behind in future health emergencies. We acknowledge that key work lies ahead, particularly in finalizing a fair and functional PAPS system. Our region includes countries affected by displacement and humanitarian crisis. Youth in these settings carry heavy burdens, yet continue to innovate and serve. Their perspectives must shape how this agreement is operationalized. We urge member states to prioritize inclusive dialogue and to ensure the PAPS Annex is finalized ahead of the WHA 79. Mr. President, the youth of our region will bear the full weight of the pandemic agreement. The pandemic altered our present and disrupted our entire trajectory. Our education, mental health, career opportunities, and sense of security have been irreversibly impacted. The time to act is now. We remain fully engaged, drawing from the deep well of our shared experience. This agreement is a promise that we will live through, will not be repeated in silence. A promise that future generations will be better protected, better heard, and better prepared. As the world is watching this historic moment, we, the youth of the EMR, are ready to partner, ready to build healthier, fairer planet we all deserve, leaving no one behind. Shukran, merci, thank you.
Thank you. Now let us turn to the youth from the Republic of Korea.
Honorable Chair, distinguished delegates, my name is Tae-hyung Kim, a youth delegate from the Republic of Korea and one of the negotiators involved in the pandemic agreements. It is a great honor to share my voice at World Health Assembly. This agreement is more than just a document. It is a shared commitment by the global community to overcome pandemics and safeguard future generations. The recent pandemic has shown us the critical importance of solidarity, international cooperation, and equitable access. I was deeply impressed by the dedication, inclusiveness, and flexibility demonstrated by member states throughout the negotiation process. To future generations, this agreement sends a clear message: solidarity in action. Aligned with the Assembly's theme, One World for Health, it marks a decisive step toward a more united world. As a young member of this global community, I sincerely hope this agreement becomes a true intergenerational promise and a meaningful step toward our shared future. I, too, will meet my responsibility. Thank you.
Thank you. Now let us turn to the youth speaker from Ethiopia.
Honorable Ministers of Health, Director General, distinguished delegates, esteemed leaders, and my fellow youth. Imagine for a moment that a deadly pandemic were to emerge today. Would the world be ready? As a young person, I'm encouraged to say yes, because today I wake up knowing that we have built systems, partnerships, collective commitment capable of mounting an effective and coordinated global response through the pandemic agreement. On April 16, 2025, we witnessed history. The adoption of the pandemic accord is not just a document ratified. It is a promise made, a promise that the world, having endured the devastation of a global pandemic, chooses not to forget the griefs which never had a funeral. That we choose to prepare, to protect, and to stand together in solidarity, stronger, smarter, and more united. Ladies and gentlemen, my name is Abigail Awi. I'm a youth delegate of Ethiopia, and as the voice of African youth, I write today with not a prepared applause, but with a fire in my heart, an urgency of a generation that knows what is at stake. Because too many young Africans, the generation knows what is at stake, and the memory of COVID-19 is not just a chapter in a textbook. It is a scar that is still healing. It is the classroom that stood empty. It is the dreams that paused and the family that never recovered. This accord is a beginning, but an accord is only as strong as our courage to implement it. So today, to our leaders, I do not just congratulate you. I challenge you. I challenge you so that this accord must not gather dust in binders. It must breathe in budgets, in policies, in leadership, and of course, with the youth perspectives included. I would like to conclude by saying that the world has taken a step. And congratulations. Thank you so much. Amasaganal.
Thank you to all the youth speakers from the different WHO regions. Distinguished delegates, we will now turn to the high-level segment of our agenda. This historic plenary is suspended.
academic treaty.
议员说话。声音好像有点小。议员再测试一下。说几句话，辛苦中文议员说几句话测试一下。
不要在这说吧，是要起身吗？这个给它关掉。
English channel testing. English channel testing. Testing 1 2 3. Testing 1 2. English
May I request our delegates to be seated? We will start the high-level segment of our assembly. This meeting is called to order. Your Excellencies, Director General, Honorable Ministers, distinguished delegates, I am pleased to welcome you to the high-level segment of the 78th World Health Assembly. A historic milestone was witnessed in this room some few minutes ago when member states, in a show of solidarity, adopted the report of the first meeting of Committee A containing the draft pandemic agreement and resolution. In so doing, 3 years of intense negotiations by member states with engagement of relevant stakeholders has culminated in a truly commendable achievement for global health that helps all countries to prevent, prepare for, and respond to pandemics. We are honored to have you with us on this auspicious occasion. Without further ado, I am delighted to invite Ms. Farah El-Dibani, an Egyptian acclaimed opera singer who has performed at many global events, including the 2022 FIFA World Cup, to perform her rendition. Ms. El-Dibani, you have the floor.
Mi cantar se vuelve gitano cuando Oggi giorni, oggi plangli, rimaniateli, sraniroli, viscovimini, oggi giorni, unislina viek, moja šasti.
Thank you, Ms. Eldibani, for that uplifting performance. It is my privilege now to invite His Excellency, Mr. João Manuel Concalves Lourenco, President of Angola and Chairperson of the African Union, to address this assembly.
Bom dia a todos.
Good day to everyone. Your Excellency Teodoro Boza, President of the 78th World Health Assembly, Your Excellency Prime Minister of Croatia, Your Excellency Dr. Tedros Ghebreyesus, Director General of the World Health Organization, distinguished ministers of health and heads of delegations, esteemed partners. Allow me to congratulate the outgoing president of this World Health Assembly for the efforts that were put into the service of this important organization for all of us, which achieved results during his mandate, results that encourage us to continue with initiatives to implement and strengthen capacity in the intervention of the WHO in tackling concerns that involve health on a global level. It's an honor for me to speak at this World Health Assembly on behalf of the African Union and its 55 member states so that we can address the potential ways forward in creating the reality of building one world for health. The slogan of this year, which illustrates our commitment to guarantee a world where health is an inalienable right for each human being, independently of their geographic, ethnic origins, their beliefs, or their social status. At the end of this year, we will conclude the first quarter of the 21st century, and the challenges that we have had to face in this period, which include the COVID-19 pandemic as the most illustrative example of bringing to light our weaknesses and compelling us today to think outside the box, to identify and implement opportunities that can arise from crises. We are concerned to see that the prospects of making real the global health agenda and the 2063 African Union agenda is growing more distant because of the weakening of our respective health systems, which are overburdened and affected by the persistent economic crises and under pressure from recurring armed conflicts, and are severely impacted by epidemics, pandemics, and climate change. But even in this difficult context, we must never lose the hope. On the contrary, we must reinforce our belief that in these situations of crisis, we have an opportunity and a duty to redefine the paradigms so that we can build a future with greater equity and resilience, which can be wrought out of adversity and which will reinforce solidarity, not just for our continent, but for the whole world. Just as in the area of the environment, countries in Africa are rarely the starting point of these crises, but always are on the front line of the victims of these crises that cross borders. In the area of health, we observe the same dynamics, and every step backwards of global support has a decided negative impact on our health systems, with direct consequences on the lives of our citizens, and in particular our children, and they clearly endanger the sustainability of socio-economic development of the African continent. President of the World Health Assembly, Director General, I would like to take this opportunity to welcome the spirit of resilience of this organization, which has faced both a difficult situation in a reduction of investment, of shortfalls of contributions and commitments, and unfair and unjust criticisms of the supposed inefficiency, or even worse, alleged inutility. My quality as the pro-tempore president of the African Union allows me to say that we all have a duty to protect and strengthen the WHO, a body which continues to be an essential partner for the majority of our countries, in particular in times of need, of suffering, and it has a great utility and opportunity through its technical programs and early warning systems that help us with the operations in the field. And we must keep working on this. We have no doubt that the world needs a stronger World Health Organization with sustainable and predictable financing to ensure its full operationalization. The WHO continues to be the only institution with a universal mandate to protect global health and promote equity, as well as the only multilateral cooperation platform in the area of global public health. Despite this reality, the WHO today operates with a financing model that is just 18% of its program budget, and which is covered by assessed contributions that are predictable. Africa is united in supporting the proposal to increase assessed contributions because investing in the WHO is not an act with no use, but is a strategic investment in the future of humanity. Investing in the WHO is also a commitment to global security and mutual prosperity and a world which is less vulnerable. In the face of this reality, Angola is honored to join 14 African countries that have already pledged contributions to the investment round, and we are pleased to announce here a contribution of the value of $8 million American dollars. So we call on member states of the organization so that they can reinforce their contributions as a gesture which is responsible and showing global solidarity in order to compensate for the support that has been withdrawn and to guarantee that the WHO can continue to play its vital role in protecting the health of people. Beyond preserving what already exists, we have now come to the time when we have to take concrete steps towards universal health coverage. This is an ideal that we must pursue without ceasing and ensure it becomes a reality. We cannot continue to live in a world where there is a possibility, where the opportunity for a child to survive depends on where they're born or where a mother has to choose between buying medicines or feeding her children. In order to progress with our common objective. We must face up to the health systems as something that are an important investment and not unnecessary spending. That means that we must value primary health care, invest in professionals, and guarantee that no community is left behind, be they urban, rural, rich or poor. We are fully aware that talking about health for all does not just imply the need to build more hospital infrastructures, train more healthcare professionals and produce more medicines and vaccines. It also involves investment in the education of our citizens in basic sanitation, access to safe drinking water, healthy food and housing and sporting activities. In Angola, we have made significant progress, and I'm proud to tell this assembly about that the results that we have from our major investments and thorough work that we've been carrying out over the last 8 years. As a result of this, child mortality fell from 44 to 32 per 1,000 live births, and mortality of under fives went from 68 to 52 per 1,000 live births, and maternal mortality fell from 239 to 170 per 100,000 live births. Our health care system is universal, and in order to meet the needs of the populations and put people at the center of our work, we have expanded our health care infrastructure at the 3 levels within our National Health Service, and we have moved on from 2,612 healthcare units in 2017 to 5,958 in 2024, and that includes 15 new tertiary level hospitals, 10 orthopedic rehabilitation centers, which give priority to primary health care, with more than 50% of these new units dedicated to that. We increased by 46.1% the healthcare workforce since 2017, and we initiated a wide-ranging project for specialization, which aims to train by 2028 some 38,000 doctors, nurses, diagnostics and therapeutics technicians, with a priority for family and general medicine, which aims to accelerate progress towards universal health coverage. Over the last 8 years, we have set up 538 dialysis monitors across 12 provinces, and we increased hospital beds by 20,000 in 2024. And today we have a total of 44,222 hospital beds across the country, and we increased intensive care beds by 1,409, which gives us a total of 1,609 intensive care beds throughout our country. On the other hand, we are increasing financing and improving health sector policies with a particular focus on primary health care, aiming towards prevention and early detection, because we believe that the adequate responses to epidemics and pandemics depend on these factors. President of the World Health Assembly, Director General, ladies and gentlemen, this assembly is the ideal platform to welcome the historic consensus on the draft WHO pandemic agreement, which is more than a moral commitment, as it is the first legal instrument of this type that has been drawn up by the international community in the area of health, and which will allow in future a more systematic and wide-ranging framework for cooperation, which means that in future no country will face the next pandemic alone. The African continent contributed in a constructive way to this process, constantly defending an agreement based on equality, equity, solidarity, and fair access to vaccines, medicines, and diagnostic tools, including local, regional production, transfer of technology, and benefit-sharing mechanisms, which is our aim, and to guarantee that by 2035, 55% of healthcare products and 50% of vaccines will be produced in our continent. These advances will contribute to strengthening our healthcare systems, in particular impacting maternal and infant health and reducing the weight of infectious diseases and NCDs. The continent has also set a great deal of importance to digital transformation of healthcare systems, and it will allow us to provide better healthcare, in particular in remote areas. Africa must take and be an active part of the global solution for healthcare as a full partner with the capacity for production, with centers for innovation and networks of research in the continent. As the pro-tempore president of the African Union, I welcome the imminent signing of the Memorandum of Understanding, which has been updated between the African Union Commission and the World Health Organization, which will reinforce and renew our strategic partnership. The MOU will expand the areas of cooperation, in particular in maternal health, child health and nutrition, and non-communicable diseases, mental health and response to humanitarian crisis, and the threats to health that are climate-related. The climate crisis is changing the healthcare and health profile across Africa. The continent faces an increase in the burden of diseases such as cholera, malaria, and other arboviruses, as well as food insecurity, which results from floods and droughts. There is a major effort from countries in Africa to implement actions which are under the framework of the WHO One Health program, and it is essential that we pay attention to issues that are related to the interconnection between human, animal, and environmental health, and the problems that come around from environmental change and the urgent need to have climate financing on the global agenda, looking at climate change, and that it clearly and explicitly supports resilience in healthcare systems. The African Union is fully committed to a Pan-African vision which promotes integration towards sustainable growth and prosperity with an impact on the quality of life of its peoples. Angola remains firmly committed to that regional and global effort. Ladies and gentlemen, in Africa, we face an alarming reversal of more than 2 decades of progress in healthcare results. The triple threat of the reduction of external financing, the increase of the debt burden, and an increase in outbreaks of diseases is taking our healthcare systems to the limit. In 2022, apologies, says the speaker, from 2022 to 2024, we registered an increase of 41% in public health emergencies. And this is the direct result of a weakened prevention of interrupted healthcare, primary healthcare services, and low investment over years. Official development aid for Africa fell by more than 70%. It fell from 81 billion to just 25 billion. At the same time, the debt servicing went beyond 81 billion, and These numbers represent lost opportunities, delayed interventions, and lives lost. Our modeling suggests that between 2 and 4 million more Africans could die each year because of weakened healthcare systems. 40 million more Africans could be pushed into poverty by 2030. We must act decisively now, and that is why the African Union adopted the vision of the Africa CDC with a continental pact to rethink financing, governance, and healthcare service provision. This is not a declaration of intent, but a roadmap for transformation based on the new order for public health, and places the Africa CDC at the heart of a new vision, a vision where Africa leads the way forward in its own healthcare destiny through innovation, investment, and strengthening institutions. We call for an increase of domestic financing to align our external funds with national plans, develop and implement financing mechanisms which are innovative, including solidarity funds, healthcare titles, and schemes for regional security, leveraging mixed financing to invest in infrastructure, supply chains, and manufacturing that are local. All of this must be led and supported by good governance, and Angola is fully committed to this way forward. We have increased our national health budget, and we have directed investments to water, sanitation, hygiene, and we're aligning our national strategy with the Lusaka agenda to guarantee that our changes and reforms will be part of a continental effort. This vision also places at its center local manufacturing to ensure health sovereignty for Africa. The COVID-19 pandemic showed us the catastrophic consequences of depending on distant supply chains, and we were the last in the line for vaccines and diagnostics, and we must never allow this to happen again. Angola is investing in pharmaceutical production and is supporting the accelerator for vaccine manufacturing in Africa, working with regional partners to guarantee regulatory harmonization, grouped buying, and shared distribution networks. Africa carries 25% of the global disease burden, but receives just 1% of global spending on healthcare. The health crisis in Africa is not one of capacity or knowledge, it's a crisis of exclusion. Exclusion from financing, of decision-making, from technology, and from global solidarity. We call, therefore, on our partners to do more. As a shared responsibility, we call on the World Bank, Gavi, the Global Fund, and others to adapt their models to support systems led by Africa. And we call on the WHO to continue to strengthen its collaboration with Africa CDC. We are going to remove the artificial barriers that prevent institutions such as Africa CDC from receiving direct subsidies. And we also aim to accelerate the recognition of the African Medicines Agency and to co-invest in our continent's future. Cholera is one of the examples that is most clearly showing the need for urgent action. Since the beginning of this year, at least 15 countries in Africa are simultaneously fighting outbreaks of cholera and have declared them as national emergencies. We mobilize significant resources just as we did to tackle COVID-19. We have set up partnerships with the Africa CDC, WHO, UNICEF, and Gavi to distribute vaccines, and we set up treatment centers. Our healthcare workers are on the front line, and many of them are volunteers who work day and night. But this crisis is a continent-wide emergency that needs a continental response. The President of Zambia, as a African Union champion for cholera, will summon a high-level summit of African heads of states in coming days. This summit will concentrate fully on cholera and in developing long-term solutions which cut across sectors to cover water, sanitation, hygiene, surveillance, and manufacturing of vaccines. We call on and invite all our partners to support this initiative, and we call on global leaders to join us in Lusaka. We are building the African Fund for Pandemics and investing in climate health systems. Peace and healthcare are interconnected. Insecurity, forced displacement, and armed conflicts undermine access to care across the Sahel, the Great Lakes region, and the Horn of Africa. In Angola, we know that health is a peace dividend, and that's why we call on this Assembly to support the inclusion and integration of healthcare in strategies for peace building in humanitarian corridors and post-conflict recovery. We call on the United Nations systems to support a joint initiative for health and peace of the African Union and the United Nations, so that we can protect healthcare infrastructure and healthcare workers in conflict zones. In Africa, women are the backbone of our healthcare systems and the pillars of our efforts for peace. Any healthcare system that does not empower and protect women is a system which, at the end of the day, will fail. We will invest in innovation, in maternal care, and platforms for community-based delivery of healthcare. Our youth must be at the center of innovation in healthcare. We will build capacities for biomedical research, invest in public health schools, and make the most of digital technology to reduce the distance between patients and providers, ensuring that health will not be a privilege of the few, but a right for every child in Africa. We are building a new era of resilience in African health, but we need your partnership. President of the World Health Assembly, Director General, ladies and gentlemen, I hope that we will be able to leave this Assembly with the firm proposal and aim of transforming the vision of One World for Health as a reality that will be lived by every child, every woman, and more widely by every human being in our planet. But for that to be happening, we must not forget those human beings who are in their majority innocent civilians who every day see their life and health threatened in in wars in Africa, Europe, and the Middle East, through war injuries, destruction of healthcare installations, forced displacement, and being blocked from access to the most elemental, most basic elements of human rights: food, water, and medicines that are essential to human life. Malnutrition, severe malnutrition, threatens children, women, older people, and patients through occupying armies, and this must be brought to an end so that we can still save thousands of lives in the DRC, Sudan, and the Gaza Strip in Palestine. Let this Assembly be remembered as the turning point in history when we chose solidarity instead of division, and a commitment and work instead of indecision. I repeat my call to Member States so that our support for the WHO will continue, and it will strengthen with a firm commitment in policy and responsibility. We renew our commitment to universal health coverage as an instrument that is more powerful to ensure global equity, sharing, and this is the way of fulfilling our responsibility to protect life and dignity for all. This Assembly must be remembered not for its words, but for its determination to save lives. Thank you very much for listening.
Thank you, Your Excellency. It is now my honor to invite the Prime Minister of the Republic of Croatia, Andrej Plenković, to address the Assembly.
Thank you very much, President Herbosa. Thank you very much for the invitation, distinguished Director General, Dr. Tedros Ghebreyesus. My greetings to His Excellency President of Angola, João Manuel Gonçalves Lourenço, and also to the Vice Prime Minister of Government of China, His Excellency Liu Guozhong. Excellencies, ladies and gentlemen, for over 75 years, the World Health Organization has stood as a beacon of hope and a guardian of humanity's right to health, working to ensure that all people, regardless of where they live or the circumstances they face, can achieve the highest attainable standard of health. Today, in an increasingly uncertain and unequal world, it is our shared responsibility to preserve and strengthen the central role of the WHO as the leading and coordinating authority in global health. In that regard, I wish to pay sincere tribute to Director General Dr. Tedros Adhanom Ghebreyesus for his steady leadership during the COVID-19 pandemic, an unprecedented global challenge. I still recall our meeting in Davos in January 2020, which was suddenly cut short as Dr. Tedros had to return to Geneva to address a mysterious outbreak in China. The world would soon come to know it as COVID-19. In view of these past challenges, the current review of the WHO should serve as an opportunity for the organization's further institutional empowerment, reinforced mandate and long-term resilience. Our joint commitment to the concept of one world for health has never been more relevant. I am particularly proud that this shared vision continues to be shaped by the legacy of a distinguished Croatian, Dr. Andrija Štampar, one of the WHO's founding fathers and the first president of the World Health Assembly. Dr. Štampar's legacy is not only a source of national pride, but a cornerstone of modern global public health. His pioneering work laid the foundation for a people-centered, preventive and equitable approach to health. He was among the first to articulate health as a basic human right, linking it to social justice, education and economic development. Ideas that will decades later resonate in the Alma-Ata Declaration and the Sustainable Development Goals. Already in the interwar period, he brought his ideas beyond the borders of his homeland, traveling the world as an expert of the League of Nations. From 1933 to 1936, during his mission in China, he helped organize public health services and witnessed firsthand the universality of health challenges. These global experiences shaped his conviction that health is a shared human concern, transcending geography, politics, or culture. He believed deeply in the power of public health education, in strong primary care, and international cooperation as essential tools to build healthier societies. The WHO Constitution still echoes his vision. Later today, I will have the honor to join you at the unveiling of a sculpture in front of WHO headquarters, a tribute to Dr. Andrija Štampar and to all health workers around the world. This artwork, donated by the Croatian government, will stand as a lasting symbol of our shared commitment to public health and international solidarity. Following Dr. Štampar's principles, Croatia has built a solid national health system, grounded in equity and universal access. While we continue to make historic investments domestically, we remain a steadfast advocate of global health security. Our active support for the WHO pandemic agreement reflects our commitment to better preparedness, prevention, and response to future health emergencies. As a founding member of the group of friends of the treaty, Croatia is resolute in its dedication to building a safer and more resilient world. Yet our engagement goes beyond treaties. Croatia believes deeply in the transformative potential of the Sustainable Development Goals and the 14th General Programme of Work. These frameworks are not merely aspirational. They offer a practical and strategic path towards a healthier and more equitable future for all. We are particularly proud that Croatia currently ranks 8th globally in the SDG implementation, making steady progress in health-related targets. We remain committed to true partnership because in an interconnected world, only solidarity ensures resilience and progress. In recent years, Croatia has played a proactive role in strengthening health emergency preparedness. At the last year's World Health Assembly, our initiative led to the adoption of the first ever resolution on strengthening health emergency preparedness for disasters resulting from natural hazards. This milestone underscores our deep commitment to patient safety, health systems resilience, and the protection of the most vulnerable. We promote an all-hazards approach that integrates the One Health framework, disaster risk reduction, and strong primary care. In a world where crises, whether pandemics or climate-related disasters, are more frequent and complex, such integrated preparedness is not optional, it is essential. However, our leadership in health extends well beyond preparedness. Croatia has led the consultation process for the resolution on strengthening support for the health workforce and the development of the WHO Action Plan for Health Workers. This reflects our long-standing commitment to capacity building, education and support for those who dedicate their lives to safeguarding public health. In this spirit, and drawing inspiration from Dr. Štampar's visions of public health education, Croatia is committed to supporting the global expansion of the WHO Academy and broadening access to health workforce training. We are guided by a clear conviction. Strengthening global health begins with empowering those who deliver it. Excellencies, ladies and gentlemen, recent crises have delivered a sobering but essential lesson. We must remain alert to the diverse and evolving nature of health threats, whether caused by human activity, emerging risks, or natural phenomena. In a world of interlinked risks, only coordinated global action can deliver lasting solutions. Croatia remains fully committed to working with all partners to confront these challenges, protect the most vulnerable, and uphold the principle of universal access to equality healthcare. In this context, sustainable financing of the World Health Organization is not a technical issue, but a strategic imperative. A financially stable WHO is not only a symbol of our collective commitment, it is a functional necessity. Sufficient, reliable, and long-term funding is vital for WHO to effectively lead, coordinate, and deliver on its global health mandate, enabling timely responses to emergencies and meaningful support where it is needed most. Investing in health is not an expense. It is a strategic investment in our shared security, stability and prosperity. A strong and resilient health systems form the bedrock upon which all other progress is built. Guided by the Sustainable Development Goals and the 14th General Programme of Work, let us join forces to build a future where every person in every part of the world has access to the care they need and rightfully deserve. As Andrea Stampar wisely reminded us, the issue of public health and the work on its improvement should be a task for everyone. May this enduring principle continue to guide the mission of the World Health Organization. Croatia, for its part, will remain a dedicated and active partner in this shared journey toward a healthier and fairer world. Thank you very much.
Thank you, Your Excellency. I'm now pleased to invite the President of the French Republic, His Excellency, Mr. Emmanuel Macron, for his remarks.
Messieurs les chefs d'État et de gouvernement.
Heads of State and Government, Director General of the World Health Organization, dear Dr. Tedros, ladies and gentlemen, ambassadors, dear friends, 5 years ago, mankind had to endure one of the biggest upheavals of our century, facing the COVID-19 pandemic. Together, we managed to hold the line. Together, we managed to find solutions, including, of course, vaccines, and together we invented new rules, whether it was on the sharing of intellectual property or to speed up industrial processes. In so doing, we demonstrated that multilateralism is not an empty concept, but the best and most effective way of protecting our people. This is something we still know in the face of new threats such as mpox, cholera, and all the various wars and conflicts underway around the world, their victims and those who continue, even in very difficult situations, to continue to try and protect and treat them. I must, at this stage, thank most warmly the humanitarian specialists who are doing this work. Today, however, we have made a historic step forward, an agreement, a pandemic agreement, which was negotiated for 3 years and which is now a victory for our people who will be better protected against future pandemics. France worked tirelessly and will continue to do so to promote the values enshrined in that treaty. We will be able to make a more effective and equitable response to pandemics, treating everyone in the same way. You cannot eradicate a pandemic if you leave one area anywhere untreated, and this we need to remember in the next pandemic. We also need more effective and transparent warning systems than we had at the time of COVID, and bring together the concepts of equity and efficacy. We need to act as quickly as possible, yes, but we also need to spread the innovations we've made more quickly, because those two things are inseparable. We understand now the need to better share scientific information and develop tests, vaccines and treatments, and do so quickly. This is a sine qua non for our collective security and safety. There's another thing that I have to say here today, at a time when some people think we can do without science and throw research overboard. Not only would that damage the health of all of us, but it would particularly constitute a threat to those who put these theories forward. They will be the first ones at risk when a new pathogen arises and we have nothing to fight it with. Our first line of defense is the WHO. Its standard-setting work, agreements such as the one we've just agreed, these will be a shield to protect us from the diseases which will come in the future. To all those researchers who want to freely continue to do their work, I would like to repeat here and now something that we already heard from the European Commission. We will be happy to welcome you in Europe because that will be good for Europe, for medical research, for you and for everyone. It's not a question of if we will have a new pandemic, it's a question of when we'll have it. And now with this treaty, we have a valuable tool along with our policy of One World for Health, we'll be able to better protect human health, animal health, and the health of our environment. And those three things go together. We are working still very specifically as well on issues which affect our people on a day-to-day basis, such as epidemics of chikungunya or dengue, which are currently affecting several French territories. I think of pollution of the air, pollution of water, by things such as microplastics. We still have to work hard on these things. On the One World for Health Day, we will be meeting in Lyon for One Health Summit, which we hope will enable us to make solid progress with governments and parties from the private sector acting together in a spirit of goodwill. The COVID pandemic taught us one very, very valuable lesson above all the others, and that is you can't do anything without nurses, doctors, and medical staff. That means providing them with proper working conditions, a decent salary, and dealing with the distortions which have been caused globally by the emigration to other countries of staff in countries which already have a shortage. We need to provide better sustained training to medical staff and humanitarian workers, not in our own countries, but everywhere around the world. On this agreement, one final point. This will help us to increase the production of medical products needed to save lives during a pandemic around the world. France has been pushing this alongside you, Dr. Tedros, for many, many years. For example, in the RN messenger production hub in South Africa, which is now working with dozens of other countries. I'm also thinking of the vaccine accelerator in Africa, which has a budget of $1 million and which we launched with Gavi in Paris some time ago. This agreement also signals a victory of multilateralism over divergence and fragmentation, a victory of determination over indifference. It proves what we all know, that human lives should prevail over other narrow-minded interests. Thank you to all of you who fought so hard to get this agreement, especially those who chaired the INB from France and South Africa. In adopting this agreement, we are doing so because we strongly believe that protecting people's health means also protecting peace, security, the stability of our planet and our countries in the future. Ladies and gentlemen, Dr. Tedros, you may rely on strong support from France as we continue to reform and overhaul our World Health Organization so that it can emerge stronger and better equipped to tackle tomorrow's challenges. Thank you very, very much from me for all that has been done to bring this treaty about, and I hope that continues in the future. I wish you an excellent assembly. Thank you.
Thank you, Excellency. I now have the honor to invite the President of the Republic of South Africa, His Excellency, Mr. Cyril Ramaphosa, to deliver his statement.
Your Excellencies, ladies and gentlemen and friends, since its establishment, the World Health Organization has been the custodian of global health and well-being. It has saved millions of lives and continues to do so. As the international community, we salute the role that WHO continues to play in safeguarding the health security of the peoples of this world. The World Health Assembly is meeting at a time when we are confronted by global health challenges that are complex and interconnected. These include pandemics, antimicrobial resistance, non-communicable diseases, and growing health risks associated with climate change. To meet and overcome these challenges, we must deepen international cooperation. We must sustain investment in health and find innovative solutions that safeguard the health and well-being of all. Our experience of the COVID-19 pandemic exposed the fragilities of the international system as we witnessed how poorer countries were being pushed to the margins in the global scramble for treatment and care for their people. At the same time, there were laudable acts of cooperation between countries and within the international community. The pandemic was a stark reminder that collective action is key to achieving sustainable global health systems. The principle of equity must guide all our endeavors. As President Nelson Mandela said, health cannot be a question of income. It is a fundamental human right. The World Health Assembly is an opportunity to chart a course for a future where the health and well-being of all is secured. As the countries of the world, we must support every effort to enable the WHO to fulfill its mandate. South Africa is hosting the G20 this year under the theme Solidarity, Equality, and Sustainability. We are using our G20 presidency as South Africa to champion universal health coverage, pandemic preparedness, addressing non-communicable diseases, and equitable health financing. We wish the 78th World Health Assembly well in its deliberations. Together, let us expand the frontiers of health innovation, health equity, and health access. Let us leave no one behind. I thank you.
Thank you, Excellency. I now have the honor to invite the Prime Minister of the Kingdom of Thailand, Her Excellency Ms. Patongtam Shinawatra, for her remarks.
Mr. President, Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Excellencies, distinguished delegates, it is my honor to address this assembly at a time when the international community is in dire need to reaffirm its collective commitment to health and sustainable development, especially as we approach the last phase to implement the Sustainable Development Goals, or SDG. Health is the foundation of human dignity and a driver of progress. Strengthening health systems is essential to achieving the SDG. And not only Goal 3, but also those related to poverty, education, gender equality, and climate action. In Thailand, we are integrating health into all policies to build a resilient society. And for that, universal health coverage remains central to Thailand's national agenda. Since 2002, we have expanded access, reduced catastrophic spendings, and are now moving toward a more integrated digital-first health system to reach underserved populations and improve continuity of care. We also recognize the power of technology in managing non-communicable diseases, or NCD, applying data-driven tools for early detection, and promoting healthier behaviors at scale. In parallel, we are reinforcing our preparedness for public health, emergencies, and natural disasters, while integrating mental health into recovery and resilience strategies. We welcome the conclusion of the pandemic agreement negotiations, which reflects the strength of multilateralism in building a safer world. Thailand continues to address the broader determinants of health, including through urban development and inclusive governance. We are proud that Bangkok, Ban Suan, Klong Chaun, and Sadao have been recognized under the WHO Healthy Cities Network. Excellencies, distinguished delegates, lastly, allow me to reaffirm Thailand's unwavering belief in the World Health Organization. Our enduring partnership is rooted in equity, solidarity, and a shared vision. The health is a global public good. We stand by WHO through its essential reforms and remain committed to walking this path together. Thank you.
Thank you, Excellency. Before we proceed further with the statements from our other high-level guests, I would like to invite a performance from two exceptional Filipino artists whose voices have graced global stages. Elaine Vival, a prize-winning soprano, and Eunice Miller, a classically trained soprano. You have the floor. Thank you for Ms. Vibal and Ms. Myler for those soothing and inspiring songs of hope. I now have the honor to invite the Vice Premier of the State Council, People's Republic of China, His Excellency, Mr. Louis Guzong, to address the Assembly.
Your Excellency, President of the World Health Assembly, Teodoro Herbosa, Your Excellency, Director General Tedros Adhanom Ghebreyesus, dear delegates, ladies and gentlemen, friends, good morning. I'm happy to be invited to the high-level welcoming ceremony of the 78th World Health Assembly. On behalf of the Chinese government, I would like to warmly congratulate the convening of the Assembly and the adoption of the WHO Pandemic Agreement. 5 years ago, at the online opening ceremony of the 73rd World Health Assembly, Chinese President Xi Jinping called on all countries to come together and build a global community of health for all. During the COVID-19 pandemic, China shared pandemic-related information and prevention, control, and treatment experience with the world with no reservation at the earliest possible time. China overcame difficulties and provided pandemic response supplies to more than 150 countries, including the United States, and sent 176 batches of medical workers to 57 countries that can add up to 3,000. China stays true to its commitment of advancing the building of a global community of health for all. China is responsible and constructive on the matters of COVID. China's role and contribution has been widely recognized by the international community. Any attempts to smear China and the WTO will prove futile. The world is now facing impacts of unilateralism and power politics, bringing major challenges to global health security. As pointed out by President Xi Jinping, multilateralism is a sure path to address the difficulties and challenges faced with the world. China strongly believes that only with solidarity and mutual assistance can we create a healthy world together. Ladies and gentlemen, the Chinese government put people and life first. It firmly adopts a development path that prioritizes health and is promoting health coverage for all. It is now home to the world's largest medical and health service system, with Chinese people's level of health continues to go up. At the same time, China actively participates in the global health governance. It keeps coordination with the WHO in responding to public health events, experience sharing, formulating international rules, providing overseas health assistance, and various other fields. Ladies and gentlemen, China stands ready to work with the international community to meet with global threats and challenges hand in hand and build together a global health community for all. For this, I would like to propose 3 points as follows. First, uphold multilateralism. All sides need to firmly support the WHO to play a central coordinating role in global health governance. Support WHO to perform its duty in an independent, professional, and science-based manner. China will provide an additional quota of financial support to the WHO that can add up to $500 million in the coming 5 years, and support the WHO to effectively play its part. Second, uphold fairness and equity. All sides need to firmly support developing countries for their reasonable concerns like public health arrangements, vaccine allocation, and technology transfer, so as to strive for a vision of health for all. China will actively implement the related outcome measures of the 10 partnership actions of the Beijing Summit of the Forum on China-Africa Cooperation, helping African countries to build up public health capacity. Third, uphold openness and innovation. All sides need to seize the historical opportunity brought by the new round of science and technology revolution and industrial transformation, deepen innovation and cooperation on health, and improve equitable access to medical and health services. China will cooperate with Belt and Road participating countries to launch more small and beautiful livelihood projects in their health sector, so as to add to the sense of gain for people from those countries in health. At last, I wish this World Health Assembly a great success. Thank you.
Thank you, Your Excellency. I now have the honor to invite the Secretary General of the United Nations, His Excellency, Mr. Antonio Gutierrez, to give his remarks.
The goal to promote health, keep the world safe, and serve the vulnerable. This is the long-standing mission of the World Health Organization. And it is especially crucial at a time of deep reductions in funding for health and development, even while military spending reaches record highs. Now more than ever, our world needs a coherent global health architecture that responds rapidly to crises and strengthens protection and well-being for all. The COVID-19 pandemic highlighted deep gaps in collective preparedness and served as a powerful reminder that no one is safe until everyone is safe. The WHO Pandemic Agreement builds upon these lessons and reflects the power of multilateralism in action. After years of negotiation and compromise, you have come together to consider this landmark agreement, recognizing that global health emergencies demand global responses. If adopted, this will be only the second international health convention under the WHO Constitution after the Global Convention on Tobacco Control, which came into force 20 years ago. So I urge you to make history, to strengthen global preparedness against pandemics, to ensure equity and solidarity in responding to health threats, and to uphold the promise of health as a fundamental human right for this generation and the next. But health is about more than emergencies. The upcoming high-level meeting of the General Assembly on the prevention and control of non-communicable diseases and the promotion of mental health offers a crucial opportunity to improve countless lives. Progress towards universal health coverage is essential to building resilient systems grounded in primary care and delivering the 2030 Agenda. I also urge you to match ambition with resources by strengthening investment in the World Health Organization and ensuring the sustainability and predictability it needs to build a healthier, safer, and fairer world for all.
Thank you, Mr. Secretary General. Now it is my privilege and delight to invite the President of the Republic of the Philippines, His Excellency Ferdinand Romualdez Marcos Jr., to deliver his remarks.
WHO Director General Tedros Adhanom Ghebreyesus, Excellencies, distinguished delegates, ladies and gentlemen. The Filipino people salute the 78th World Health Assembly for its pivotal role as a community of nations that will herald tremendous transformation in multilateralism for global health. The WH presidency, entrusted by fellow member states of the Republic of the Philippines, is therefore a medal of humility and honor for the Filipino people. We dedicate the nomination to all the health workers, including the many Filipino health and care workers around the world, to the unsung heroes of the post-pandemic recovery, and we pay a special tribute to the sectors who struggle every day to access health care. As a country that stands alongside the pathfinders and bridge builders of nations, we attach great importance to our abiding commitment to promote and protect the health and well-being of the human family. We champion multilateralism as a single viable platform for nations to find convergence amidst crises and provide hope to humanity. You have our solemn pledge that the Philippines' stewardship in global health governance will remain a testament to the alignment and support of our domestic policies and investments to global solutions to transnational challenges in health. For the year 2023 to 2027, the government of the Republic of the Philippines takes on leadership roles in various multilateral fora for health, including the Stop TB Partnership Board, the UN Health for Life Fund Steering Committee, Pandemic Fund Governing Board, and the UNAID Programs Coordinating Board. We are also privileged to have hosted the Philippine Pacific Health Initiative and the 7th Global Ministerial Summit. We look forward with anticipation to the Philippine hosting of the ASEAN Health Cluster meetings. The Philippines hosting of the WHO Western Pacific Regional Office in Manila for 74 years is an attestation of our commitment to the WHO and is an important part of our shared history with the organization. Excellencies, as one of the founding members of the WHO, the Philippines has always attached utmost importance to public health and to equity. The WHO family has come a long way with the pandemic agreement, which aims to operationalize equity in pandemic prevention, preparedness, and response. It is also poised to be adopted by this pivotal health assembly. With our stature as a community of nations, the pandemic agreement will fuel our actions to show that we can change the status quo, marked by striking inequities towards a world of solidarity and fairness if member states listen to each other and commit to work together towards a common vision. Strengthening multilateralism is not an option. This is our common obligation. The world looks to this assembly to deliver urgent actions, including sustainable financing and resolutions on the concerns of health and care workforce, disease response, and the pandemic agreement to revitalize the World Health Organization. All member states will win with our shared conviction that our multilateral initiatives will protect the most vulnerable and reach those furthest behind. We are the WHO, and together we will play a central role in advancing towards the achievement of the Sustainable Development Goals and to bring the WHO closer to the communities. On behalf of the Filipino people, I congratulate Dr. Tedros for his resilience and excellent leadership. I extend my very best wishes and goodwill to the WHO family of member states forever bonded by international and intergenerational solidarity. Thank you.
Thank you, Excellency. I now have the honor to invite the President of Peru, Her Excellency Dina Boluarte Segarra, for her remarks.
Ladies and gentlemen, heads of state and government, ladies and gentlemen, ministers of health, representatives, permanent representatives of the member states of the WHO, Dr. Tedros Adhanom, Director General of the World Health Organization, representatives of international organizations, civil society, and academia. As President of the Republic of Peru, I am most grateful for the invitation to take part in the high-level segment of this 78th World Health Assembly, and I bring you the greetings of the people of Peru. This is an historic assembly, given that after more than 3 years of intense negotiations, the WHO pandemic agreement is to be adopted. Peru was one of the countries that was most impacted by COVID-19, and we have supported from the beginning the negotiation process. it's an important achievement for the world. My country celebrates this legacy for future generations, and it also provides us with an unprecedented opportunity to strengthen global health governance and to build resilient systems centered on equity and solidarity in order to make real the right to health of all people, leaving no one behind. In a context of a health crisis, we need more unity and less fragmentation. Health security throughout the world will only be achieved through cooperation, and that's why the slogan of this world, One World for Health, is ever more valuable. In line with this aim and aspiration, we have been promoting a greater understanding of the impacts of climate change and plastic contamination on health. And on the other hand, Peru has progressed in the early detection and giving priority to cancer treatment, in particular with the aim of ending cervical cancer by 2030, and that's why 99.73% of the population is now covered and affiliated to a health insurance system. And we have services through integrated networks with a focus on primary health care and active participation of 1,659 health committees, so that we have equitable access and to ensure that we improve healthcare and health. Peru would like to reaffirm its commitment to the work of the WHO in complex times such as those we are currently living in. The world needs to keep working towards multilateralism, solidarity, and as guiding principles that will help us overcome current and future challenges in the world. Thank you very much, and I wish you every success in the Assembly.
Thank you, Excellency. And now I have the pleasure to invite the President of the Republic of Senegal, His Excellency Mr. Bassirou Faye.
Monsieur le Président de la 60...
Mr. President of the 78th World Health Assembly, ladies and gentlemen, ministers, Director General of the World Health Organization, distinguished delegates, I'm happy to have the opportunity to join you at this 78th World Health Assembly. I would like to offer my warmest congratulations to Dr. Tedros and to his staff for the hard work they do every day in the service of global public health. Ladies and gentlemen, our recent painful experience with the COVID-19 pandemic and our fights against other diseases of global concern prove that health emergencies are now more or less permanent. Therefore, health has to remain at the heart of government policy. We are all equally vulnerable in the face of diseases that sweep across political borders, and that goes for all of us, whatever the economic and social level of development of our countries. We need each other. Our collective salvation lies in cooperation, not in the pursuit of narrow-minded national interest. It is therefore essential that we pool our resources, that we invest in research, that we engage in innovation and develop our infrastructure so as to ensure that we can build sustainable, resilient, and equitable health systems. We have undertaken ambitious reforms, developed priority programs, and strengthened our health infrastructure in precisely that spirit of partnership. Today, Senegal's National Pharmaceutical Regulatory Authority has achieved maturity level 3, and we have WHO certification for a type 2 medical emergency response team. That means that we can respond effectively to health crises, not only in Senegal, but beyond Senegal's frontiers too. These achievements are a major step inter alia towards local production of medicines and drugs, universal health coverage, and achieving health sovereignty. This progress is the fruit of a solid partnership with WHO and with other technical and financial partners and backers. If it is to help countries to further develop their health systems, then WHO needs to be properly funded. Health is a global public good, and therefore the organization's member states must guarantee that it has sustainable financing. On this point, I urge international solidarity and cooperation to provide sustainable support for this investment cycle. It will be a major key to improving global health security. Furthermore, access to more sustainable financing mechanisms will speed up the process of transforming and overhauling our health systems by allowing us to make large investment in advanced technological innovations such as digitalization, telemedicine, and artificial intelligence. On behalf of my country, Senegal, I would like to reiterate our commitment to work with WHO and all other nations to build a future where health for all isn't just a dream any longer, but something that everybody can live and enjoy every day. Have a successful assembly, and thank you for your attention.
Thank you, Excellency. I have the pleasure to now invite the President of Mongolia, His Excellency Mr. Kulelasuk Ukna.
Эрхэм мөндөд чуулганы дарга Дэлхийн эрүүл мэндийн байгууллагын ерхий захирлаа, эрхэм мөндөд төлөөлөгчд, хатагтай ноёдоо. Хүндрэлтэн бидний хамгийн эрхэм баялаг болох мэндийн асуудлыг хэлцгээр.
Warm greetings from Mongolia, the land of eternal blue skies and rich history, to all of you gathered here from around the world to discuss one of humanity's most precious values, health. I wish you great success in the work. The COVID-19 global pandemic has clearly demonstrated the critical importance of being prepared for future pandemics, implementing preventive measures, responding effectively, and building resilience. In response to those lessons, the World Health Organization has initiated the development of the WHO Convention Agreement or other international instrument on pandemic prevention, preparedness and response. And has established an intergovernmental negotiating mechanism. I extend my deep appreciation to the leadership and staff of the World Health Organization, as well as the member states and all those who have actively contributed over the past 3 years to bring this important effort to the agenda of today's Assembly. I believe that this multilateral mechanism, born from solidarity and cooperation, will significantly contribute not only to the health and well-being of people around the world, but also to future generations by shaping effective health protection policies. Esteemed delegates, the ultimate goal of any country's development is to ensure well-being, peace of mind and happiness of its population. The physical and mental health of citizens is one of the most vital indicators of a nation's social progress and constitutes a fundamental national asset. We Mongolians have long believed in the wisdom that a sound mind resides in a healthy body. Since 2022, Mongolia has been implementing a national movement called Healthy Mongolian, aimed at ensuring the health and well-being of our citizens and their families. This movement consists of 4 main components: healthy eating, healthy behavior, health education, and public physical activity. Our overarching goal is to prioritize illness prevention rather than merely cure. We aim to shift from curative measures to preventive approaches to promote access to nutritious food, encourage exercise and healthy lifestyles, and enhance health literacy. Esteemed delegates, since joining the World Health Organization in 1962, Mongolia has consistently supported and actively collaborated with the organization. Over the past 6 decades, the WHO's technical support and policy recommendations have positively impacted the quality of life of Mongolian citizens and have been vital in helping Mongolia navigate the COVID-19 pandemic crisis with minimal losses. In this era marked by increasing multilateral cooperation, the active participation of each member state is essential to reinforce the role of the WHO and expand its operational scope. In Mongolia, we believe that the power of a crowd is important. I'm pleased to share that Mongolia has made a monetary donation to help address the funding challenges currently faced by the organization. We reaffirm our commitment to continue providing support within our means. Finally, I call on all member states to fully support the WHO's mission and join hands for the health and well-being of all humanity. Thank you for your attention.
Thank you, Excellency. We shall now resume plenary under Agenda Item 8, Report of the Main Committees. It is my great pleasure to invite the Director General of the World Health Organization, Dr. Tedros, to give his remarks.
Thank you, Your Excellency. Your Excellency, Joao Lorenzo, President of Angola and Chair of the African Union. It's beyond words. Thank you so much for blessing us with your presence. I'm very grateful, Your Excellency President. Obrigado. And Your Excellency, Andrei Plenković, Your Excellency, Liu Guzhong, Excellencies, Honorable Ministers and Heads of Delegation, dear colleagues and friends. My thanks to Farah El-Dibani, Elian Vidal and Eunice Miller for sharing your voices, your gifts with us this morning. My thanks also to all youth delegates who have joined us today. And my thanks to Member States for your historic adoption today of the WHO Pandemic Agreement. One of the first major speeches I gave after my election as Director General at this Assembly 8 years ago was at an event at Columbia University in New York. The subject I was asked to address was whether 100 years since the 1918 influenza pandemic, the world was ready for the next one. That pandemic erupted during the First World War, and although it killed more people than the war itself, it was quickly forgotten and its lessons went unheeded. I said then that a devastating epidemic could start in any country at any time and kill millions of people because we're not prepared. I said that global health security is only as strong as its weakest link, and that no one is safe until everyone is safe. And I said that we do not know where or when the next global pandemic will occur, but we do know that it will exact a terrible toll, both on human life and on the global economy. The following year, 2018, at the World Government Summit in Dubai, I said the same thing again. And I said it again in 2019 in an interview with Time magazine, a rare interview that I did. Later that year, on the 31st of December 2019, I was at home with my family when I received a notification on my phone. As the rest of the world was celebrating the dawning of a new year, WHO staff in Beijing and Geneva had picked up the first signal of cases of viral pneumonia in Wuhan. The next day, the 1st of January 2020, when most of the world was on holiday, WHO was not. Immediately, we activated our emergency incident management system and alerted the world, and within the first 10 days, we convened global experts and published comprehensive guidance for countries on how to protect their populations and health systems. I'm proud of WHO's response to the pandemic, and of course, we're not perfect, no one is, but from the moment we received that first signal, and for the next 3 years, we did what WHO was created to do. We acted fast, and we told the world that what we knew when we knew it. We brought countries, experts, and partners together to review rapidly evolving evidence and distill it into guidance on which governments, health workers, and our partners relied. We worked to give member states the evidence, the advice, and the tools to protect their people. And we did it all based on evidence, data, and our values of equity and solidarity. The COVID-19 pandemic turned our world upside down. It stole at least 20 million of our sisters and brothers. And many of us in this room lost someone we know or love. It took a terrible toll on health workers who worked under extreme conditions, often without the equipment they needed. It wiped more than $10 trillion from the global economy. It damaged or destroyed the livelihoods of countless people. It pushed millions into poverty. It interrupted the education of millions of students. It took a heavy toll on the mental health of countless others who suffered from fear of the disease or the loneliness of isolation. It gave rise to torrent misinformation and disinformation that undermined trust in science and institutions, a trust deficit that remains to this day. And it exacerbated political tensions within and between nations. Just over 2 years ago, I declared an end to COVID-19 as a public health emergency of international concern. The crisis has passed, but the scars remain. Millions of people continue to suffer from the lingering effects of long COVID, and the social, economic, and political aftershocks continue. The pandemic has ended, but we still don't know how it started. Understanding how it did remains important, both as a scientific imperative and as a moral imperative for the sake of those who lost their lives. We must not forget the painful lessons that COVID-19 taught us. We must learn from them, and together that's what we have done in 10 ways. First, financing. COVID-19 showed us that financing for pandemic prevention, preparedness, and response in lower-income countries was woefully inadequate. So with the World Bank, WHO established the Pandemic Fund in 2022 to support capacity building in lower-income countries. Already, the Pandemic Fund has provided $885 million in grants, catalyzing an additional $6 billion in co-financing, supporting 47 projects across 75 countries. Second lesson is intelligence. The pandemic showed us the need for much stronger intelligence to detect signals of outbreaks earlier and enable a more rapid response. That's why in 2021 we established the WHO Hub for Epidemic and Pandemic Intelligence in Berlin. And we expanded the epidemic intelligence from open sources platform, which monitors millions of signals every year and has tripled in scale to to include 103 countries. Third, local production. The COVID-19 pandemic taught us that manufacturing capacity for vaccines and other medical countermeasures was concentrated in too few countries, and that we need much greater geographical diversification of production. So in 2021, we launched the mRNA Technology Transfer Program based in South Africa, which is now sharing technology with a network of 15 partner countries globally. And we also established the Biomanufacturing Workforce Training Initiative, including Global Training Hub in the Republic of Korea, which has helped to train over 7,000 participants in biomanufacturing. Fourth, access. The COVID-19 pandemic exposed vast inequities in access to vaccines and showed the need for a mechanism to coordinate equitable sharing of vaccines, therapeutics, diagnostics, and other tools. So in 2020, with a consortium of partners, we established the Access to COVID-19 Tools Accelerator and COVAX, which distributed almost 2 billion free doses of vaccine to 146 countries. In lower-income countries, COVAX represented 75% of vaccine supply, saving an estimated 2.7 million lives. Building on the lessons learned from ACTA and COVAX, we established the Interim Medical Countermeasures Network in 2023, which has helped to coordinate access to vaccines against Mpox. And fifth, supply chains. The pandemic highlighted gaps and inefficiencies in supply chains for life-saving medical products in emergency situations. So together with our partners, we expanded and optimized our supply chains to ensure urgently needed supplies get to where they're needed on time, every time. 6, sample sharing. This is pathogen sample sharing. The pandemic highlighted the need for a mechanism that enables countries to share samples and sequences of pathogens to facilitate research and development. So with the support of the Swiss Confederation, we established the BioHub, which is facilitating the sharing of pathogens with epidemic and pandemic potential. And the Research and Development Blueprint for Epidemics and Pandemics is managing collaborative open research consortia for 12 families of pathogens involving over 5,000 scientists to drive R&D and identify gaps in countermeasures. 7th, rapid deployment. The pandemic highlighted the need for an international system to coordinate the rapid deployment of experts to respond to emergencies nationally, regionally, and globally. So in 2023, we established the Global Health Emergency Corps, which just last month ran a two-day simulation called Exercise Polaris with 350 experts from 15 countries. 8th, the IHR COVID-19 exposed limitations in the international health regulations. So you negotiated and adapted a package of amendments to strengthen them. And 9th, UHPR. It highlighted the need for increased accountability, so we created the Universal Health and Preparedness Review, a peer review mechanism. And 10th, and the last one, the pandemic showed us that pathogens don't carry passports, viruses don't need visas, and bugs don't respect borders. For everything that makes us different, we're one species, sharing the same planet, the same DNA, and the same vulnerabilities. A shared threat demands a shared response. And so in 2021, you, the member states, made the historic decision to negotiate a new legally binding agreement on pandemic prevention, preparedness, and response. Last night, you approved it. 124 member states voted in favor and none against. We recognize that 11 countries abstained, and we hope that all member states will continue to work together to address the concerns that some of you have. And this morning, you adopted it. There are many people who have helped to bring us to this point, too many to name. But I would especially like to thank 3 people who first proposed and drove the idea. His Excellency Kais Saied, the President of Tunisia, who proposed the idea in a phone call in April 2020. And the late President of Chile, His Excellency Sebastián Piñera. And His Excellency Charles Michel, former President of the European Council. I also thank the co-chairs of the intergovernmental negotiating body who have guided us throughout this process. Ambassador Anne-Claire Amprou of France, Precious Matsoso of South Africa, and former co-chair Roland Dries of the Netherlands. I also thank our vice chairs, Ambassador Tovar of Brazil, Ambassador Ramadan of Egypt, Dr. Viroj of Thailand, Ms. Flair Davis of Australia, and our former vice chairs, Ambassador Ahmed Salama of Egypt, Ambassador Honsi Kozo of Japan, and Mr. Kazuho Taguchi, also of Japan. And I thank my colleagues in the WHO Secretariat who have worked tirelessly to support this process over the past few years. My Deputy Director General, Dr. Mike Ryan, Dr. Jawan Bahjur, and the many colleagues who supported them. Over the past 3.5 years, you have engaged in very tough negotiations. Sometimes the disagreements were sharp, the discussions heated, and the frustration evident. Sometimes it seemed the distance between you might be too great to overcome. There were those who said you would not succeed, could not succeed, and who did not want you to succeed. But you kept your eyes on the prize and did not stop until you had achieved it. You didn't want to give up on this very important prize. Step by step, you moved from red lines to green text, from entrenched positions to landing zones, and from contradiction to compromise, convergence, and consensus. You began your work in the middle of one crisis, and you have reached this milestone in the middle of another. And today, we celebrate. Today, you have sent a loud message that multilateralism not only works, but is the only way to find shared solutions to shared threats. Let's not understate what you have achieved. You have made the world a safer place. I repeat, a safer place. And our youth delegation agree with that, and they have said it in their statement. By establishing a new system for sharing pathogens, vaccines, and other tools, by facilitating the transfer of technology, knowledge, skills, and expertise, by setting up a coordinating financial mechanism, by establishing a global supply chain and logistics network, by mobilizing a skilled, trained, and multidisciplinary national and global health emergency workforce, and much more. This is what the pandemic agreement will do. But there is one thing it will not do. It will not infringe on national sovereignty in any way, nor give the WHO Secretariat power to impose mask or vaccine mandate or lockdowns. Anyone who says it will is clearly mistaken. You, the member states, have made that very clear in the text of the agreement itself. You're all aware of the torrent of mis and disinformation that we have faced through the negotiation of this agreement. And although you have now adapted it, deception and distortion will continue. So we must be very clear about this. The pandemic agreement has been negotiated by countries, for countries, and will be implemented in countries in accordance with their own national laws. Nobody knows this more than you. It doesn't belong to me or to my colleagues in the WHO Secretariat. It belongs to you, the nations of the world, and through you, to your people. And of course, although today we celebrate reaching a major milestone, it's not the end of our journey. We have not yet reached our final destination. In the coming weeks and months, you will begin the process of negotiating the annex on the pathogen access and benefit sharing mechanism, PABS. After that, the process of ratification will begin before the agreement finally enters into force. There will still be hurdles to overcome. But having seen the commitment that got you this far, I have every confidence that you will go the rest of the way. Let me return to the question I was asked to address in that speech at Columbia University. Is the world prepared for the next pandemic? By the way, people ask me this question now many times. Many people who meet me say, are we prepared? My answer, we can never be prepared enough. There is always more we can do. But are we better prepared now than we were when COVID-19 struck 5 years ago? My answer, absolutely. With this agreement, we're better prepared for a pandemic than any generation in history. And that's true. And all the 10 things which I have outlined earlier. While negotiating the pandemic agreement, we have been building the 9 things which I have outlined. Because we learned, the world learned from the challenges of COVID. Failure will always be there. But the key is, have we learned our lessons? I think we did, and that's why we're doing the 10 things. The most important being the 10th one, which is the pandemic agreement. Excellencies, Mr. President, Joao Lorenzo, honorable ministers, dear colleagues and friends. Since 1948, the nations of the world have gathered at the World Health Assembly to discuss common health threats and to find a common path forward. There have been many historic moments. In 1969, the Assembly adopted the International Health Regulations. In 1974, it approved the expanded program on immunization that has saved millions of kids. In 1980, it declared the eradication of smallpox. In 1988, it adopted a resolution to eradicate polio. In 2003, it adopted the Framework Convention on Tobacco Control, which is saving lives as well. And in 2021, at only the second special session of the Health Assembly, you decided to negotiate a new international agreement on pandemic prevention, preparedness, and response. Your adoption this morning of the WHO pandemic agreement will rank among the most significant achievements in the history of this organization and of global health. Those of us who were lucky enough to be in the room at 1:57 a.m. on the 16th of April, or in committee last night, or here this morning, will remember it for the rest of our lives. We will all be proud to say, I was there. But the point is not the words of the agreement on which you have spent so many hours discussing, debating, and deciding. The point is the people of our world. This is about making the world safer for them and their children and grandchildren, for us, for our children and our grandchildren. Together. Thank you for your determination to get this done. Many were skeptical, but you got it done. And this is through determination and commitment. And I have seen it spending the whole night in a windowless auditorium in a basement. I was so moved when I saw you negotiating the whole night, from 9 to 9, non-stop. That moved me, and I could see the determination and commitment. That's why it happened. Thank you for showing that in our troubled world, nations can still find a way to work together. And thank you for the gift you have given the world today. A special gift on May 20th, 2025. That's your gift to the people of the world, the best gift. Thank you so much. I thank you.
Thank you, Director General Dr. Tedros. I would like to invite the high-level guests to join me and the DG in front of the podium for a group photo with the delegates. I invite all delegates to stand for this photo. First, I'll suspend it. Correct. I'm supposed to. The plenary is suspended. Correction. Let us now suspend this item, and we will return to the statements from our high-level speakers. Please take your seats. I now have the pleasure to invite the President of the United Republic of Tanzania, Her Excellency Ms. Samia Hassan, for her remarks.
Your Excellency, Chair of the World Health Assembly, WHO Director General, distinguished delegates, ladies and gentlemen, it is an honor to address this historic assembly to renew our shared commitment to health as a human right and key foundation to sustainable development. With the enduring support from WHO, United Republic of Tanzania continues to make great strides in the health sector, particularly in public health and pharmaceutical governance. In 2018, Tanzania Medicines and Medical Devices Authority became the first national regulatory authority in Africa to be recognized by WHO to have achieved maturity level 3. This is a right path on achieving pharmaceutical sovereignty in Africa and strengthening our collective initiative to ensure access to safe, effective, quality-assured medicine and health technologies towards universal health coverage. Additionally, our primary healthcare services expanded from 6,790 facilities in 2014 to 11,275 in 2025, translating to 78% of the population accessing healthcare within 5 kilometers. Furthermore, health centers providing emergency surgery, including cesarean sections, have increased from 107 in 2015 to 577 in 2024. All these efforts led to reduction of maternal mortality rate from 556 deaths per 100,000 live births in 2015 to 104 deaths in 2022. Other strides made are in the reduction of harmful practices such as female genital mutilation from 10% in 2015 to 8% in 2022, reducing complications of pregnancy and childbirth. Certainly, Tanzania could not have realized all this without WHO's steadfast partnership at all levels. We remain grateful for walking this journey with us. Excellencies, despite these gains, challenges still remain. Our health systems are under strain from health rates and rising cost of healthcare, to mention but a few. In addressing some of these challenges, we are undertaking a comprehensive reform in public health financing, including the introduction of the universal health coverage, so as to pool resources for equitable access to quality health care, infrastructure, and human capital development. Primary health care and service integration remains our priority for a holistic approach. Excellencies, in conclusion, I urge all of us to reaffirm our commitment to WHO as the cornerstone of health collaboration. United we stand, divided we fall, and in this regard, we must garner all our efforts to build a world with better health security. We must ensure no one is left behind. Wishing you a successful assembly, and I thank you so much.
Thank you, Excellency. I have the honor to invite the President of Cabo Verde, His Excellency Mr. Jose Neves, for his remarks.
Cabo Verde ascendeu à independência em 1975. Há 50 anos, a situação sanitária era quase de calamidade generalizada e desnutrição grave. O arquipélago tinha...
Our archipelago had a life expectancy of 56 years and an infant mortality rate of 108 per 1,000 live deaths. The situation was extremely difficult and the provision of drinking water was insufficient. Sanitation was also insufficient and there was a lack of coverage in terms of infrastructure and health care. This was fertile ground for the appearance of various diseases such as tuberculosis, whooping cough, diarrhea and others, including measles. In the face of this situation, the authorities set up priorities such as health infrastructure and the fight against poverty. Cabo Verde was part of the WHO in the year after it was created, with the first agreement in order to create fruitful production through strong presence of our country at the WHO. This significantly contributed to us setting out patterns of excellence and quality healthcare. This alliance that we created translated into significant support in which strategies were defined, as well as frameworks and sectoral and multi-sectoral policies. More specifically, we developed the national health system and created universal health coverage, as well as providing protection for health emergencies. I'd also like to highlight the valuable support for the fight against epidemics and for setting up vaccine campaigns. We received the certification as a malaria-free country. We are very grateful as a country for the excellent cooperation that we've had over these years. By way of thanks, the President of our Republic gave the WHO the Emile Cabral Prize last year, showing that the WHO had led the fight in difficult situations that faced humanity in terms of health over the last few years, particularly the COVID-19 pandemic, for example. So, we would like to give warm thanks to the whole of the WHO and all of those who have dedicated themselves to commemorating the anniversary. We would like to use all means at our disposal so that WHO can continue with its noble mission of saving lives. Thank you.
Thank you, Excellency. I have the honor to invite the Prime Minister of India, His Excellency Mr. Narendra Modi, for his remarks.
Excellencies and delegates, Namaste. Warm greetings to everyone at the 78th session of the World Health Assembly. Friends, the theme of the World Health Assembly this year is One World for Health. It resonates with India's vision for global health. When I address this gathering in 2023, I had spoken about One Earth, One Health. The future of a healthy world depends on inclusion, integrated vision, and collaboration. Friends, inclusion is at the core of India's health reforms. We run Ayushman Bharat, the world's largest health insurance scheme. It covers 580 million people and provides free treatment. This program was recently extended to cover all Indians above the age of 70 years. We have a network of thousands of health and wellness centers. They screen and detect diseases such as cancer, diabetes, and hypertension. Thousands of public pharmacies provide high quality medicines at far less than the market price. Friends, technology is an important catalyst to improve health outcomes. We have a digital platform to track vaccination of pregnant women and children. Billions of people have a unique digital health identity. It is helping us integrate benefits, insurance, records, and information. With telemedicine, nobody is too far from a doctor. Our free telemedicine service has enabled over 340 million consultations. Friends, due to our initiatives, there has been a heartening development. The out-of-pocket expenditure as percentage of total health expenditure has fallen significantly. At the same time, government health expenditure has gone up considerably. Friends, the health of the world depends on how well we care for the most vulnerable. The global south is particularly impacted by health challenges. India's approach offers replicable, scalable, and sustainable models. We would be happy to share our learnings and best practices with the world, especially the global south. Friends, in June, the 11th International Day of Yoga is coming up. This year, the theme is Yoga for One Earth, One Health. Being from the nation which gave yoga to the world, I invite all countries to participate. Friends, I congratulate the WHO and all member states on the successful negotiations of the INB Treaty. It is a shared commitment to fight future pandemics with greater cooperation. While building a healthy planet, let us ensure that no one is left behind. Let me close with a timeless prayer from the Vedas. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukh bhag bhaved. Thousands of years ago, our sages prayed that everyone should be healthy, happy, and free from disease. May this vision unite the world. Thank you.
Thank you, Excellency. I have the honor to invite the Prime Minister of Norway, His Excellency, Mr. Jonas Gahr Store, for his remarks.
Excellencies, ladies and gentlemen, and dear friends, in times of political and financial uncertainty, this 78th World Health Assembly is an opportunity to demonstrate the continuing importance of this extraordinary fine organization, the World Health Organization. Norway was a founding member of WHO and has been and continues to be a staunch supporter of the organization and its critically important mandate. I have personally a strong commitment to this organization, having had the privilege of serving as Chief of Staff to former DG, Director General, Dr. Gro Harlem Brundtland, some 25 years ago. And as I see it, it's pretty easy to state the following. WHO is more important than ever in our globalized world. WHO has repeatedly demonstrated its importance as a global, convening and coordinating body. It is the leading normative and technical organization on health matters. It stands in the Constitution, and it has always been demonstrated at the critical junctures of our times. WHO plays an important role both in health emergencies and in humanitarian response. This period of uncertainty is pushing us to reconsider the global health architecture. Regardless of how this develops, WHO will have to maintain a central role, and all governments should be held accountable to delivering on that. So from Norway's point of view, it's our ambition that WHO comes out of this crisis stronger and more resilient, sustainably financed, and more efficient, transparent, and accountable. I know this is complicated with leading nations pulling out, but we have to continue our work, and I would like to applaud the efforts of the WHO Secretariat with the strong leadership of DG, Dr. Tedros, to deliver a realistic budget and a bold revised structure. Hasn't been easy, but you have been working well on it. We, the member states, need to do our part. It's our responsibility to assure sustainable financing, including by increasing assessed contributions, because this is crucial in order to safeguard the core mandate of the organization and to assure a WHO fit for the future. Supporting WHO is a collective responsibility and for the mutual benefit of all its member states. Progress in the negotiations for a pandemic agreement demonstrates that we can work together and make meaningful steps towards better health preparedness for all. Let that be a beacon of light guiding us in the time to come. So to all of you working for world health, in small local communities, in large hospitals, in research, and across the whole web of health in the world, this year's World Health Assembly is there to thank you, to underline the importance of the work you are doing, and to show politically that we take responsibility for the futures. There are some countries, again, pulling out, not taking that shared responsibility. That cannot make the rest of us stop and look in another direction. We have to move on, and thank you for being committed, and thank you for doing that critically important work for humanity.
Thank you, Excellency. I have the honor to invite the Prime Minister of Singapore, His Excellency, Mr. Wong Lawrence, for his remarks.
Excellencies, distinguished delegates, ladies and gentlemen. We are meeting at a time of great uncertainty. The international system is under severe strain. The COVID-19 pandemic is behind us, but the risk to global health persists, and the need for coordinated action has never been greater. The World Health Organization, or WHO, has shown us that international cooperation remains possible in these uncertain times. Countries successfully concluded negotiations on the pandemic agreement last month. This historic agreement aims to improve how the world prepares for and responds to future pandemics. Despite deep differences, countries managed to reach consensus after 3 years of tough negotiations through sustained diplomacy. This is an encouraging development, both for global health and for multilateralism. It reminds us of what we can achieve as an international community when countries come together to find common ground and forge shared solutions. Singapore is firmly committed to an open, stable, and rules-based multilateral system. We believe that global problems require global solutions. That is why we have been steadfast in supporting the WHO and its role in global health governance. Singapore was amongst the first to pledge to the WHO investment round last year. This reflects our commitment to global health security. Recently, we hosted the Philanthropy Asia Summit, which provided a platform for philanthropic foundations to support meaningful causes, including more resilient healthcare systems. Singapore will continue to do our part for global health, because as the theme of this World Health Assembly reminds us, we all live on one world for health. A disease anywhere can become a threat everywhere. Viruses know no borders. The only way forward is for all of us to tackle global health challenges together. So let us join hands to build a healthier, safer, and more resilient world for all.
Thank you, Excellency. I have the honor to invite the Prime Minister of Lao People's Democratic Republic, His Excellency, Mr. Soneksai Sifadoni, for his remarks.
สบายดีขอแสดงความนับถือมายังบรรดาท่านรัฐมนตรีผู้อำนวยการใหญ่องค์การอนามัยโลกในบรรดาแขกผู้มีเกียรติทุกท่านข้าพเจ้ารู้สึกเป็นเกียรติที่ได้มีโอกาสมีความเห็นในกองประชุมสมัชชาใหญ่ขององค์การอนามัยโลกครั้งที่ 78 ในมื้อนี้การระบาดของพยาธิโควิด -19 ที่ผ่านมาถือเป็นระยะเวลาที่ยุ่งยากสมควรแต่ในขณะเดียวกันเหตุการณ์ดังกล่าวได้เฮ็ดให้พวกเราเห็นถึงความ
While a dark time, the COVID-19 pandemic, as has often been said, without health we have nothing. Our country joined the World Health Organization in 1950. WHO became the first United Nations agency to establish an in-country office, taking place in 1962. Since then, we have worked hand in hand in improving maternal and child health, immunization, communicable disease control, quality of care, capacity building for our health workforce. Health promotion and more, with many significant achievements towards health for all, including in the early 1980s, oral polio vaccines were introduced. And in 2000, the disease was eliminated. We have eliminated trachoma in 2017 and lymphatic filariasis in 2023. Similarly, the threat of malaria has almost been eliminated, with less than 350 cases in 2024. Between 2000 and 2023, the ratio of mothers lost during pregnancy or childbirth has fallen by over 80%, one of the fastest declines globally. Throughout these milestones, WHO has been a constant and committed partner. We could not have achieved these results without WHO. Lao PDR has a great deal of effort ahead and many more milestones to achieve, particularly implementing the Health Sector Development Plan to achieve universal health coverage, and support the country's LDC graduation. An appropriately and sustainably resourced WHO is essential to achieve our shared goals. Not just for countries like Lao PDR, but for the world. While tools like the Pandemic Accord are a demonstration of WHO's unique value to help us get there. Excellencies, Lao PDR is a proud member of WHO. And on behalf of the government of Lao PDR, health officials, healthcare workers and communities, I thank WHO and development partners for their immense support in the health sector of Lao PDR.
Thank you, Excellency. I have the honor to invite the Prime Minister of Vietnam, His Excellency Phan Minh Chinh, for his remarks.
Thưa Ngài Tổng Giám đốc, thưa các quý vị đại biểu, tôi rất là cảm ơn Ngài Tổng Giám đốc.
At the outset, I would like to thank you for this opportunity to address the 78th World Health Assembly.
Thứ 78 này, tôi muốn chia sẻ.
I would like to share with you my thoughts as follows. First, we have always placed the people at the heart of national construction and development. Deeming them as the best resource and driver for growth. Therefore, Vietnam has long given priority to endeavours concerning human development, under the principle that the people constitute the most important asset for society, and health is the most important asset of the people. Investment in the people and their well-being means investment in development. And we spare no effort in making such investment, striving to the best of our capability and available resources for healthcare and human development. Second, in today's world, issues concerning healthcare or the people are global, whole of population and comprehensive in nature. Therefore, we need to uphold multilateralism, strengthen international cooperation and unity, and offer mutual support to address these challenges. COVID-19 was exemplary for this. Other instances include climate change, aging demography, and depletion of resources. Such obstacles require the international community to join hands to overcome. This has been very much proven, and I am certain that you are all well aware of this. Third, I believe that wealthy developed countries should assist poorer developing or less developed nations. In terms of science, technology, capital and manufacturing capacity. Most notably, focus should be given to the production of medicines and vaccines to best prevent pandemics and cure diseases, consultation in establishing necessary institutions, and support in human resource development and healthcare capacity building. We hope that such assistance will continue to be provided in a more robust, altruistic, and effective manner going forward. On Vietnam's part, we are committed to implementing the regulations of the World Health Assembly, particularly the decisions made at this 78th Assembly. Although Vietnam also faces its share of hardships, we shall always be ready to contribute to these common efforts and offer our experience, knowledge, consultation and achievements to the international community. We will also continue to adhere to the warnings of the WHO and the World Health Assembly. Despite existing hurdles, Vietnam remains determined to invest further in human development and healthcare. In tandem with other countries worldwide. Only then can we build a world wherein the well-being for all can be guaranteed. And foster greater strength in promoting human development and protecting the lawful and legitimate rights and interests of the people to health, life, freedom and happiness. Once again, I would like to extend my heartfelt thanks to the World Health Assembly. May the 78th World Health Assembly be a great success.
Thank you, Excellency. I now have the honor to invite Senator the Honorable Penny Wong, Minister for Foreign Affairs, on behalf of the Prime Minister of Australia.
Excellencies, Director General Dr. Tedros, distinguished colleagues, I am honoured to join you from Australia to celebrate this historic achievement. In 2020, COVID-19 caused widespread devastation with loss of lives and livelihoods across the globe. The pandemic reshaped our lives, our countries, our economies, and our world. But while we were all impacted, it was the poorest and most disadvantaged who were hit the hardest and who paid the highest price. COVID-19 crystallised in the starkest of terms what we already know to be true. Global challenges require collective action. That's why the world came together with a shared ambition to act on hard-earned lessons, to work towards an agreement to reduce the risk of future pandemics and make the world safer for everyone, no matter who you are or where you live. Because we know these health emergencies don't recognise national borders. But if we work together, we can save lives, preserve livelihoods and boost resilience. Today we take a significant step forward in that endeavour. We recognise the importance of collaborating across sectors at national, regional and international levels, including working in an integrated way to address risks to human health, animal health and environmental health. And we agree to take concrete action collectively to strengthen pandemic prevention, preparedness and response. Adopting this agreement not only affirms our shared commitment to action, guided by principles of equity, it also demonstrates the value of the international community working together to find solutions to shared global challenges. Australia is proud to have served as the Vice Chair of the Intergovernmental Negotiating Body for the Pandemic Agreement, representing our diverse Western Pacific region, and I commend all negotiators for their hard work. I also thank Director General Tedros, World Health Organization staff and UN and civil society colleagues and other stakeholders for your support and contribution to this agreement. Let's continue to move forward together to make our world safer and healthier for all.
I now have the pleasure to invite Mr. Oliver Barhel, Commissioner on Health, on behalf of the President of the European Commission, to give his remarks.
More than 5 years ago, in the midst of the COVID-19 pandemic, a cross-regional group of leaders called on the international community to do something new, to come together to step up our international cooperation and solidarity so that we can all be better prepared for future pandemics. Now, the international community has crafted provisions that promise to change how we prevent, prepare for, and respond to future pandemics for the better. Global cooperation is essential if we want to tackle our shared problems. Pandemics know no borders. Fighting them means working together. Combating serious cross-border threats to health is essential, both at regional and international level. It protects the lives of our citizens and the prosperity and stability of our societies. The pandemic agreement has a broad scope. It ranges from upstream prevention, surveillance of environmental drivers and animal health, all the way to managing the supply chain of pandemic-related health products. If we achieve all this and strengthen domestic healthcare systems, we will have a more robust international framework for preparedness and response, in full respect to the health policy competencies and responsibilities of individual EU member states. I'm sure that the cooperative spirit of the negotiating parties will continue and grow as we negotiate the remaining part of the agreement. The European Union will remain at the forefront of efforts to support international cooperation on global health.
Thank you. At this point, I am informed that the Director General would like to recognize the contribution of two outstanding individuals for their exceptional endeavor and commitment to advancing global health. Dr. Tedros, you have the floor.
I'm honored to present the Director General's Award for Global Health to Professor Awa Mary Kolsek and Professor Sir Brian Greenwood. Their invaluable contributions have helped to alleviate the burden of malaria and other vaccine-preventable diseases and to build sustainable health system capacity in Africa. While serving as Senegal's Minister of Health, Professor Awa Mary Kolsek led landmark reforms, expanded universal access to care, and integrated disease control program. In addition to making significant contributions to scientific literature, Professor Kolsek was the Executive Director of the Rollback Malaria Partnership, leading efforts to accelerate malaria interventions in low-income countries. Professor Kolsek has played numerous other critical roles in the global health architecture, including in technical advisory roles with WHO. So such a great honor to invite Awa, my sister, to the podium to receive the award. Welcome. This way. Yeah. Senegal, yeah, Senegal. Senegal is in the house. Huh? Thank you. You know, we work. Thank you. So, yeah, thank you. Congratulations. Yes, please.
One more. Oh, so please. Yes. Thank you.
Merci beaucoup. C'est bon? Merci beaucoup.
Thank you very much, Director General, for this honor. Excellencies, ladies and gentlemen, dear friends, receiving this honorific prize before this august assembly today is, for me, a moment of profound emotion and sincere gratitude. I would like to warmly thank the World Health Organization for recognizing me with this prize. It doesn't recognize individual success, but a collective pathway of all those who I have had the honor to work with in favor of health in Senegal, in Africa, and throughout the world. As a doctor, a researcher, and a minister, a Senegalese person and a citizen of the world, that I have dedicated my life to the idea that health is a fundamental right and a fundamental necessity for human dignity. I've had the privilege of contributing to notable progress, but I've also borne witness to ongoing challenges and emerging emergencies, whether they be in terms of climate, demography, or technology. This prize is all the more important in that it symbolises trust in the values that I defend, solidarity between peoples, science in the service of humanity, and the leadership of women in the health system. At the time at which I speak to you, millions of lives are at play, with the various cuts underway and to come in health financing. I am calling solemnly for solidarity towards those people who are the most vulnerable and in the most serious situations. Now, after so much effort and sacrifice and progress, let's not abandon them. I dedicate this prize to African youth, to health professionals on the front line, researchers and decision makers who are committed to a fairer world. I dedicate it to my family, my husband, my children, my grandchildren, and my country, represented here today by the Health Minister, who represents the Parliament as well as our Ambassador. And I dedicate it to all those who have inspired me, supported me, and challenged me. Finally, I would like to say that we need to continue to work together towards a world in which everyone, wherever they may live, has the possibility to enjoy the highest possible level of health. I'd like to thank you for your attention. Thank you.
Thank you. Thank you very much. Thank you. So, once Brian is done, you will come back. You will come back for photo when Brian is done. Yeah, okay? Now, over the last 5 decades, Professor Sir Greenwood performed pioneering research and made major contributions to infectious disease control. His work on malaria has been instrumental in shaping modern approach to control this devastating disease. His contributions range from the introduction of insecticide-treated bed nets to groundbreaking trials for the RTSS malaria vaccine, the first vaccine to be recommended for widespread use. Professor Kolsek and Professor Greenwood, you have our admiration, and now I invite Professor Brian Greenwood to receive the award. And I would like to also say he is my mentor, because, you know, I'm a malariologist, so I'm recognizing my mentor, which is a good opportunity. Thank you.
Also an LSHTM alumnus. President, Your Excellencies, distinguished delegates, and of course Tedros, it's a big honor to have this award, and I really appreciate it. I've been fortunate to have had a very interesting career over. It's almost 60 years exactly since I first went to work as a very young, inexperienced doctor in Nigeria. And that's beginning a career that's really linked me to Africa ever since. And at that time, when I first went there as this young doctor, the pediatric wards were full of measles, meningitis, malaria, polio. There were still even cases with smallpox coming to the hospital. And as my first research job, I was following up autoimmune diseases to see if they had malaria had an impact on those infections. And that involved going into rural villages, going around the back streets of Ibadan, looking to see what had happened to these patients. And there was no primary care in those rural areas. And it's one person's lifetime, the under 5 child mortality was about 400 per 1,000 in parts of West Africa. So how that's changed in one person's lifetime. Many of those diseases are not gone, but are much reduced, and there has been a dramatic improvement in under 5 child mortality. In the Gambia, where I also work, that's now 40, a 10-fold drop in that thing. And WHO has played a really important part in bringing about those changes through setting up EPI, primary health care, and so on. So as a young researcher working out in Africa, it was quite difficult to keep up with what was going on in the real world of global health. There was no internet, the mail took about 6 weeks, and so on. And in 1975, I was asked to a meeting in WHO up the hill there, and that was a translational event for me, and I always had the chance to meet people, particular directors of TDR, Dr. Ade Lucas and Dr. Tori Godar, and I learned a lot for them, and it was great to have that opportunity. More recently, I've had the chance to be a member of various WHO committees and task force and so on, and that's given me really the chance to see from an outsider, not an employee, what an excellent job WHO has done in global health. And as we've heard earlier today, it's really important that despite the problems, that is sustained for another person's lifetime. So finally, I'd like to thank the many colleagues I've had, especially those in Africa that I have been able to work with through my career, and also my family, my wife, and my 2 daughters, Emma and Rachel, and one of whom is sitting there who've been a great support. And without their support, I would not have been able to be standing here today. So thank you, Tedros, and thank you. Thank you. Thank you.
We will have the 3 of us together.
So Rachel come. Yes, let's have Rachel.
Yes, please. So we have the 3 of us first, and then we will. Okay. Okay. So we can.
Us, and congratulations to our 2 worthy recipients, Professor Greenwood and Professor Kolsek. I now invite Mr. Robert Kennedy Jr.
To my colleagues in public health, I'm Robert F. Kennedy Jr., the U.S. Health and Human Services Secretary. As you know, President Trump has made the decision to withdraw the United States from the World Health Organization. I'd like to take this opportunity to offer some background to that decision, and more importantly, to chart a future path toward global cooperation on health and health security. Like many legacy institutions, the WHO has become mired in bureaucratic bloat, entrenched paradigms, conflicts of interest, and international power politics. While the United States has provided the lion's share of the organization's funding historically, other countries, such as China, have exerted undue influence over its operations in ways that serve their own interests and not particularly the interests of the global public. This all became obvious during the COVID pandemic when the WHO, under pressure from China, suppressed reports at critical junctures of human-to-human transmission and then worked with China to promote the fiction that COVID originated from bats or pangolins rather than from a Chinese government-sponsored research at a biolab in Wuhan. Not only has the WHO capitulated to political pressure from China, it's also failed to maintain an organization characterized by transparency and fair governance by and for its member states. The WHO often acts like it has forgotten that its members must remain accountable to their own citizens and not to transnational or corporate interests. Now, I believe that for the most part, the staff of the WHO are conscientious people who sincerely believe in what they're doing. And indeed, the WHO has, since its inception, accomplished important work, including the eradication of smallpox. Too often, though, WHO's priorities have increasingly reflected the biases and interests of corporate medicine. Too often, it has allowed political agendas like pushing harmful gender ideology to hijack its core mission. And too often, it has become the tool of politics and turned its back on promoting health and health security. Global cooperation on health is still critically important to President Trump and myself, but it isn't working very well under the WHO, as the failures of the COVID era demonstrate. The WHO has not even come to terms with its failures during COVID, let alone made significant reforms. Instead, it has doubled down with the pandemic agreement, which will lock in all of the dysfunctions of the WHO pandemic response. Well, we're not going to participate in that. We need to reboot the whole system, as we are doing in the United States. Here in the United States, we're going to continue to focus on infectious disease and pandemic preparedness. But we're also fundamentally shifting the priorities of our health agencies to focus on chronic diseases, which are prevalent in the United States. It's the chronic disease epidemic that is sickening our people and bankrupting our healthcare system. We're now pivoting to make our healthcare system more responsive to this reality. We're going to make healthcare in the United States serve the needs of the public instead of industry profit-taking. We're removing food dyes and other harmful additives from our food supply. We're investigating the causes of autism and other chronic diseases. We're seeking to reduce consumption of ultra-processed foods. And we're going to support lifestyle changes that will bolster the immune systems and transform the health of our people. Few of these efforts lend themselves easily to profits or serve established special interests. These changes can only occur through the kind of systemic overhaul that President Trump has brought to our country. We'd like to see a similar reordering of priorities on the global stage, especially considering the fact that through the leadership of the United States and funding from our country over the past 25 years, millions of global citizens have seen a reduction in premature death due to HIV, TB, and malaria. Let's return to the core focus of global health and global health security, back to reducing infectious disease burden and the spread of diseases of pandemic potential. I urge the world's health ministers and the WHO to take our withdrawal from the organization as a wake-up call. It isn't that President Trump and I have lost interest in international cooperation, not at all. We just want it to happen in a way that's fair and efficient and transparent for all the member states. We've already been in contact with like-minded countries, and we encourage others to consider joining us. We want a free international health cooperation from the straitjacket of political interference by corrupting influences of the pharmaceutical companies, of adversarial nations, and their NGO proxies. I would like to take this opportunity to invite my fellow health ministers around the world into a new era of cooperation. We don't have to suffer the limits of a moribund WHO. Let's create new institutions or revisit existing institutions that are lean, efficient, transparent, and accountable. Whether it's an emergency outbreak of an infectious disease or the pervasive rot of chronic conditions that have been overtaking not just America, but the whole world, we're ready to work with you. Thank you, and may God bless you, and let's all pray for the health of our children and our grandchildren.
Produced by the U.S. Department of Health and Human Services.
Okay, I see the flag of China. China is recognized. You have the floor.
Apply the point of order now. I will speak in Chinese. Mr. President, China would like to raise a point of order. The statement of the United States is grossly inconsistent with the fact and infringes on China's sovereignty and interest, against which China expresses solemn protest and resolute opposition. China believes that COVID-19 prevention and control is a scientific issue that should be guided by science and evidence, with judgments made by scientists. The United States should stop politicizing and instrumentalizing the pandemic, cease smearing and shifting blame onto other countries, and should promptly respond to the legitimate concerns of the international community. It should proactively share data on its early suspected cases with the World Health Organization and provide a responsible explanation to the people of the world. Thank you, Mr. Chairman.
Concludes the morning session, and the plenary will resume at 2:30. Committee A will also meet at 2:30 at room 20, and the Committee on Credentials will meet at room 22 at 2 p.m. Thank you. Have a good afternoon.
Thank you.